wide array of heads to use for specific body parts. So what I'll do is I'll give you a quick crash course on what each head is for specifically and why. So first thing we have is the double prong. This one is really good for people that maybe are limited in a little bit of range of motion. Maybe someone that can't quite do the extensive exercise that you want them to do in order to use it. So running up and down the mid back, low back without them having to activate the muscle. Or if we have the outside of a leg and you want to try to stay away from the bones, you can run. Or if we have outside of the knee, you can run. And that's going to stop from that pounding that can actually create more pain that we're trying to avoid. The smaller head is going to be for smaller muscles. A lot of times we have to remember that we don't have just one muscle group. There tends to be 2 or 3 together. So we talk about a quad muscle, there's 4. Biceps means there's 2, so there's 2. So what we'll want to do is the smaller one is we want to try to run the pattern of where those muscle fibers are. So a smaller head tends to be for most of the muscle tissue that we usually work on. So gastroc muscles, we have 2. We want to run inside and outside without bouncing off bone. Same thing, so smaller head for that one. When we're getting in and around some very smaller joints, like the outside of the fibula, right in through here, there's some tissue there that you want to work on, but it's very hard to get to. So you're trying to utilize just the point of this, and you're trying not to apply too much pressure, because once you get to that bone, that sucker's going to bounce and the patient's not going to be happy. So you want to kind of work around the muscle tissue, and if you can, there's this little soft spot in this little window here that's very important, because when these muscles become tight, everything pulls down and these become stretched. So you want to try to find this area in through here, which is why it's important to find this kind of a sharper tip head for those types of areas: ankle, knee, wrist, elbow, anywhere where there's more bone than there is muscle. Bigger head, obviously bigger body part. So this would be good if you're just trying to quick recovery. I don't have much time to focus. So you can run the full length of the quad. You can do 1, 2, 3, and 4. Big upper trap for those that tend to have more muscle definition. They can tenderize the upper trap muscle to help take pressure off the neck. And then obviously anyone that has big rhomboids or big back muscles, this can just be right up and down along the erectors, up and down. Same thing, you want to try to get into that cat-camel position. The flat one is more of a general. You can use this mostly on the extremities where you're not going to run into any bone, and you really just kind of are trying to push the lactic acid that's built up after a long exercise program. The muscles tend to hold on to something called lactic acid, which is it's like the poop of the muscles after they're tired. So what you're trying to do is you're trying to push it out. I always give the analogy of the toothpaste. So you're trying to squeeze the toothpaste out of the tube. So there's a technique to doing it. So biggest part of products like this, and they know, which is why I'm here, is the importance of the right way to use it instead of just using it. So flat head, mostly extremities.